Hi, Tom Cole for Buckeye Broadband, and It Matters of Toledo, and it's certainly an honor for me to welcome in a good man who's doing a great job in this community, Keary Sarabia. Keary, thank you so much. Executive CEO of RFS.
Sure.
Give me the acronym. What's that stand for?
RFS actually stands for Robinson, Felkelman, Sarabia. We actually started this organization back in 2013 of October. And actually, it's the three founders of Brian Robinson, who was just recently passed away, who was a NFL football player, graduated Howard High School. Myself and another young lady is Jennifer Felkelman, who's our Chief Clinical Officer, who oversees all of our clinical operations at our agency.
And Keary, I know we've had numerous discussions. I know so aware of the good work that your organization is doing in our community. Your TPS Proud. Mm-hmm. Tell the folks, and see if I've got this capsulated right, but you work TPS here in town. You have other branches outside that, but TPS here in town, and you work with kids at risk in our schools that are, whether it's something at home, whether it's something at school, whether it's, they're not getting their schoolwork, they're not following their coach's advice athletically, and you're helping these at-risk kids turn their lives around. Is that
Right.
is that encapsulated?
Yeah, we're dealing with kids who are having behavioral health issues in the school, repeated rule violations, suspensions, tardiness, not coming to school, academic issues. We've learned through our data and everything, and statistics, that children that are having mental health issues or substance abuse issues are actually more at risk to have a decline at school with academics and attendance, school participation. So what we're really trying to do is we're really working with the kids that when we say high risk, that our kids have a diagnosis, whether it's oppositional defiance disorder, ADHD, substance abuse issues like we discussed earlier. So we're working with these kids on hopefully decreasing these issues or decreasing the behaviors to increase the school participation, the participation in the communities, the participation in extracurricular activities, and through our data we're finding out that's actually happening. So,
Keary, I admire you for so many reasons, but I'm going to take you. You're such an honest guy. It was one of the first things that struck me about you. And some people you meet, they have a little, they have a line or they have a mantra, and they're fine, but that's what they. But you're all honesty, and you were a great athlete in high school and a great football player. And I think we can still pad you up. You look like you look like you can still play.
I got one maybe in me. That's about it.
But what gets me, Keary, is you understand where some of these at-risk kids were coming from, because you you had that experience, and then you've changed this whole paradigm and made yourself so successful and having so many great things in your life. Can you talk about that a little bit?
Absolutely. I think that the one thing when we started this agency, there's one thing that we want to do is we wanted to be different. And how we're going to be different with behavioral health services, that we felt that in order to deliver great quality behavioral health services, that we had to treat it from a holistic standpoint, which when I talk about that is treating it from not just delivering great quality services with highly trained mental health professionals that are working with these kids on their diagnosis. It's also working with the schools. It's also working with the communities. It's also working with coaches. It's working with the families. We're trying to help the families with the issues at home. We're working with the coaches to try to, the exact same behaviors, the exact same things that kids are doing during the school day or outside of school, they're also doing on the football field or the baseball field or the football or the basketball court, whatever they're doing. They're missing practices, they're coming late, they might not be bought in. So we're working with the coaches to increase that as well. We have three simple business philosophies here at RFS Charitable Foundation, which is trust, relationships, and care over gain. We believe that what makes us different is that the trust relationships that we have built with our partners, with the school districts that we serve, with the referral sources that we serve, with the families and parents that we serve. We want to have relationships. Relationships allow us to be in that family and that child's life, so we have that trust. So when we call them or when they need something, they have that relationship and they have that trust factor. And then the last thing is that care over gain is very important to us. we don't turn kids away for insurance purposes. We don't, whatever we can do to help somebody, we're going to do that. We believe in just always doing the right thing. One of the things that you did discuss prior, talk about this was, I am very transparent. One aspect about behavioral health that I wanted to incorporate was the personal factor. So often behavioral health is just here we're just providing services,
right,
but we're not wrapping around all the other aspects of that person's life. So that's one thing that I think separates us, and that's the one thing we always like to be. We like to be transparent. We want to be upfront with our referral sources, with our partners. We want to be upfront with our families. We want them to know where we stand, and we're just about doing the right thing. And that's always going to be the priority.
Keary, was there somebody in your life that took the time? Was there some light switch moment for you as a youngster when you were struggling with some things that made a difference, that kind of catapulted you into this philosophy, into this type job where you're reaching out and helping kids? Kind of take me there.
Absolutely. I have, when I left high school, I actually went to college, played football. I made some poor decisions when I came back, and when I came back to Toledo, and I was making some very poor decisions for about 8 years of my life. The one aspect that we have implemented into behavioral health is kind of like the sports philosophy of behavioral health, which is, you get knocked down, you get back up, you keep fighting. fortitude, perseverance, adversity are things that we preach all the time in the agency, and I think that we preach that because the CEO is a person who has had to implement all those attributes into his own personal life. Football was a huge part of my life. For simple facts of it, I don't want to say it's a strong term that I don't want to ever use, but football helped save my life.
Right.
To be quite honest with you.
I get that.
It developed so much in me, so when it was time for me to change, I was able to.
You had the strength to do it.
I had the strength to do it. I had to, overcome a lot of obstacles in my life. Football, I always tell people, no matter what you do for a living, no matter if it's a coach, a teacher, a social worker, CEO, we're always laying the foundation for somebody. We don't know when that person's going to get it. We don't know when the light bulb's going to come on, like you talked about. We don't know any of that information.
Right.
But the fact is that information is there for when that light bulb does come on. I've had great people in my life from a professional standpoint. It's funny how things work out. As one of my mentors who actually got me into this line of work and who brought me along tremendously now is actually an employee of our agency. So it's kind of how things
comes full circle.
So I'm proud of that. Brian was a huge part of my life as well. Brian was a huge part of my life. Coach Howard over at Start High School.
Coach Howard's an incredible man.
These are people that, it's important always to find people in your life that are going to know who you are. Your character is who you truly are. Your reputation is what people think you are.
Right.
And not too often in life do we get to surround ourselves with people who actually know our character.
Yes.
So I was fortunate enough to actually surround myself with people who knew my character despite some of the things that I were doing. Has always stayed in my corner and always did the right, stayed by my side, gave me good direction.
And they knew that light switch would come on.
Absolutely.
And they're so proud of you today.
Absolutely.
With the tremendous success you've had and the differences that you're making daily in kids' lives. Keary, I want to ask you, so many parents are struggling. Mm-hmm. The drug epidemic in our community is just terrible. The ability to kids to get in those kinds of situations and trouble, and they always think it isn't going to happen to me.
Right.
It happens to all these other people that they become addicted or they have problems, but it won't happen to me.
Right.
You got parents out there they're not professionals in behavioral health.
Exactly.
Sometimes they don't have the financial resources to send somebody to a nice rehab facility. They don't know what to do. They're trying to help their son or daughter. They don't know what to do. They don't know where to turn.
Exactly.
Parents out there in those situations, and there's a lot of them, Keary, what advice, being a professional that you are, if you're in that situation, what would you do? What would you tell them?
I think that the first part is educating yourself. I think that's always the first part. So educating yourself on the signs.
Okay.
And the signs are usually very transparent as increase of when you're dealing with a juvenile or even as an adult, somebody who's responsible, who's starting to slowly become irresponsible. Appearance. People really take appearance for granted. It's just like if I saw you in a month and you had a full beard, and you
Right.
know, I would
Right.
kind of say, okay, hey Tom, what's
What's
going
going
on
on?
with you?
Right, right,
So
right.
appearance and different things, the slipping grades in academics, changing friends. These are all things that the child or the adult may have started involved with something different. That's changing. It's a factor in changing their life. It's for negative. But I would say that there's always information out. There's a United Way help number that you can always call. They'll put you in place. Nowadays we have so much information on drugs and drug education through the schools, the guidance counselors. You can look up, in a directory for behavioral health services. All agencies in Toledo are doing a great job with the substance abuse. Everyone's pitching in, everyone's helping out as much as they possibly can with different aspects of the chemical dependent individuals. So everyone's doing their part. Unfortunately, you're right. We are getting into the opiates and the heroin that's taking a lot of lives, and unfortunately, that is a drug that is physically dependent, which creates a very, very hard obstacle for people to come off of that because it's physically dependent. But I would say just educate yourself, look at the signs, be aware, and speak to your school counselors and speak to as many people as you can and get as much resources as you possibly can.
Keary, a lot of times too, I think the parents blame themselves, and many times or most times it's not their fault. That they're a victim in this also.
Absolutely.
And how many times, Keary, does somebody who's in the drug industry, is it an offshoot of some form of mental illness where they're self-medicating for another reason? Maybe they're depressed, maybe they have depression issues. Do you run across that?
Excellent point. I think maybe when a person starts off using drugs, they may not have the mental health issues. But what happens when you become an addict, what we call a dual diagnosis, that mental health issues start occurring through the addiction.
Right.
Because what happens is because you become a liar, you become justifying your actions. You're always blaming somebody else, and what happens when you're an addict is that you actually start believing these things that you're saying, which creates these mental health issues. Yeah. You're becoming defiant. You're becoming irrational. You're not listening to people. So therefore, the mental health aspect is that. But I agree with you 110%. And I guess it always goes back and forth. You have debates on this or that, but I agree with you 110%. Drugs really cover a blanket really what's going down, what's going down the inside. It's kind of like an onion. You have to peel the layers to get to to get to the middle of it, and that's the same thing you have to do with addiction. Is that you got to figure out why. What's going on. A lot of people, especially with adults, they're estranged from their family. Is
it hard to get to the why, Keary? Is that
absolutely.
Is it hard to get a person to reveal those layers?
Absolutely, because what that requires is honesty, self-honesty, and that requires for you to look in the mirror and be honest with yourself. And then what happens usually you have to get past the justification to the blame. A lot of addicts have the mentality of it's not my fault. I'm doing everything I possibly can, or this is why this is happening to me, or I don't. This is my 12th time having a call with a suspended license, and they keep picking on me.
Right.
Well, it's not because I don't have my license. It's because the cops are out to get me, or it's because the judge don't like me, or the prosecutor don't like me, or how am I supposed to do this when this and that? And at the end, it's a long road. It's a hard road to recovery, but at the end of the day, when we go back to what we talk about, that's when we have to use kind of that sports mentality of the fortitude, the perseverance, and adversity. I always like to tell people, for as many years as it took you to mess your life up, it's going to take you just as many to get it right. Yeah. It's not an easy process by any stretch of your imagination, and that's where we kind of have those attributes that we talk about, and infusing that, and that's kind of like our mantra. That's kind of our, what we call an innovative approach to behavioral health, is that we're implementing not just behavioral health, but we're implementing that stability of, hey, we have to, man up. So like a football, we have to get there. We have to exhibit fortitude. We have to exhibit perseverance. We have to do these things because it's not an easy process. Giving up's not an option. Giving up's too easy.
Right. You
just can't do it. And I always try to tell people that no matter how bad you think your life is now, especially dealing with kids, I always tell them, like, this is where your life's at now. This is where your life's at in the whole scheme of things.
Right.
Where you want to be here,
Right.
not here.
Right.
You know, so that we gotta give people, and unfortunately, a lot of people just think about the day.
Yeah.
They're not thinking about tomorrow, next week, or next month.
Yeah, it's just such a difficult process. But Keary, you provide a number of, again, so many things I admire about you and your organization, but you always have hope. I think people give up on people, because it's easy to do. It's easy to say, hey, I helped this person. I tried here and I tried there and I tried there, and all 3 times it didn't work and went down the drain. So I'm done with you. It's hard to say when they're going to get it, right? I mean, it might take 27 times,
right?
But the thing is, you don't kind of give up on them, do you?
No.
Isn't that the thing?
No, and I don't think most of us would be in a position that we're in if people gave up on us. And it doesn't really matter that you have to go through the legal system or the criminal justice system or whatever it may be. Everybody who went through any type of adversity in their life understands that, hey, maybe it took me 3 times to pass this class. Maybe it took me, 5 years to graduate instead of 4. Maybe it took me 8 years to get my master's instead of 6. So there's things that are obstacles in everybody's life. But you just don't give up, and I'm huge on that. I mean, I think that it's very important is that we just keep working with people, as social workers, the behavioral health agency, we don't have that option.
Right.
We just don't say, hey, the kid's not getting it. We're not dealing with that person anymore. We keep working with him. We keep doing what we can. We understand. I always try to tell people that it's really not our job to figure out why. We just keep working because we will, and that's another thing too with parents that we can't bang our heads against the wall and try, why don't they get it? Why don't they get it? Because we're bricklayers. That's all we are. We're laying the foundation. Nobody can make anybody do anything they don't want to do. I can't make anyone change their life until they decide to change their life. But we can definitely provide them the information, the support, and the resources for when they're ready to change, they have it.
Keary, one of the toughest issues for me is when people, you've done such a great job of framing this and making it understandable. A lot of times you hear people say, well, you just got to let them go and hit their bottom. I've heard this so many times from people, they're living in a dumpster down on, such and such a street. Well, that's just still not, they haven't hit bottom yet. I don't know how you judge, because everybody's different. What's somebody's bottom? Where do you step in and say, okay, you're at the bottom now, so I'm going to reach out to you.
Absolutely.
Sometimes they wait too long, and the person is just dead. I mean, that's a hard thing to determine, isn't it?
Right, and absolutely. But like you just said, you hit the nail on the head. What's your bottom? Your bottom is different than my bottom.
Right.
I mean, and someone else's bottom is different from the other person.
Right.
I mean, I think as a society, we kind of stigmatize when we say hit the bottom. When we say hit the bottom, we automatically assume they're homeless, they're incarcerated, they're in jail,
they're in injustice.
It's different for a lot of people. But I feel that anything that is out of your norm, or when your life starts to spiral out of control, loss of jobs, being able to maintain a job, being able to lack of coming to school, not coming to school, participation in athletics. Truancy, suspensions, referrals. Those are all things that can contribute to someone's rock bottom, and that's what we have to focus on. I think in all too many times that we really stay away from, preventative measures more than we are dealing with the actual behaviors when they start happening. And I think that if we pay more attention to preventing some things and asking somebody, hey, how are you before it gets to that point, we can probably stop a lot more issues from happening.
Keary, on behalf of Buckeye Broadband and It Matters at Toledo, you're a man delivering a message of hope in a community, wrapped around behavioral health issues very often and drug abuse issues, and you reach out to young kids in the TPS that are at risk. And I can't think of many things that are more important to do in our community today. And we want to thank you for what you're doing at RFS, and keep it up, Keary. You're doing a great job.
Thank you. I appreciate it. Thanks for having me.
It's an honor to be with you.
Thank you.
Tom Cole for It Matters at Toledo.